Hello. Um, Hi, this is Alexis Gerald, and today we'll be shooting a video with Juliana Gerald, my daughter. Um, Juliana, today I'm going to be going over some different asthmatic medications. Do you know what asthma is? No?
No.
Have you ever seen an inhaler? Have you ever seen a kid with an inhaler? They go shh, and they breathe it in. Why do you think that they use those?
So they can breathe better?
Good job. Well, so some kids are born with asthma, and asthma is basically an attack that children feel. They haven't been physically attacked, but kind of like where they have troubles breathing out of nowhere. It can come in spells. It can be due to allergies like smoking, dust, danger, pets, and it get in a grown-up or a kid's airway, and it'll make them stop breathing, and they'll have a hard time breathing. And you know what happens if you stop breathing? What could you do?
Use an inhaler.
That's right. But if you stop breathing and you don't have an inhaler, what could happen?
You could go to the doctors, or you could die.
That's right. So basically, I'm in pharmacy and I'm learning about medications that help kids and grown-ups with asthma. And so basically, like you said, without this medication, somebody could possibly die. And you're right. So the medication that I'm going to talk to you about is going to be Flovent. And Flovent is a corticosteroid. And I know you don't know what a corticosteroid is, but it's basically something that goes in the body, and it reduces inflammation. You can have inflammation in your body, and that's what's restricting your airways. So that's kind of like what this medicine do. So this medicine is Flovent. It's an inhaler that somebody with asthma would take, you know, to decrease the signs of an asthma attack. And in nursing, we like to call it like shortness of breath or dyspnea. And that basically means painful or difficult breathing. Okay? And so I know it's probably hard for me to kind of explain this to you without an actual inhaler, but it's called Flovent, and it's a corticosteroid that reduces inflammation inside the body when a person is having an asthma attack. And, you know, most people will use it and then they'll rinse their mouth out, because sometimes this inhaler can cause like fungal infections in the mouth, and just irritation in general to the mouth and the throat. Sometimes it can cause nausea. Nausea is kind of when you get an upset tummy, or you just don't feel so good, you want to throw up. Nausea, vomiting kind of go hand in hand. When you feel like you got to throw up is nausea. Sometimes they get a headache or cough. And other times, so sometimes they get a headache or cough. And so a lot of nurses would look for this, you know, so they can make sure that a kid don't have an asthma attack. And then, you know, this medication can be given with other medications to increase its effectiveness on somebody having an asthma attack. So if you give this Flovent with another medication, sometimes called a bronchodilator, the bronchodilator will be given first to open the airways, and then you'll give Flovent, which is a corticosteroid, and it'll help, like, you know, help stop those episodes of asthma attacks. And, you know, like I told you, asthma attacks can be triggered from dirt, dandruff, smoke, pollution, pollen, animal dander, you know. And sometimes with inhalers, children or adults, they can have what's called a spacer. So they'll have the inhaler machine, that's the thing that you push and suck on, and then they'll have an inhaler so that they can breathe it in. And so that helps with the effectiveness getting the lungs, getting the medication into the body. And if you had a nurse and you had an inhaler, she would be monitoring your lung sounds. So she would be listening to the sounds of your lungs, and she also would be monitoring your pulse oxygen level. And she would do that with just putting a doohickey on your hand. And you know, that's kind of like the whole thing about asthma. Asthma is when a grown-up kid has trouble breathing. They usually use asthma medication. Different types of asthma medication is corticosteroids, bronchodilators, and the one that we talked about was Flovent, and it basically decreases the symptoms of an asthma attack, and it helps reduce what's going on with an asthma attack, so it helps the person breathe better. You want to always rinse your mouth out after you use one because it can give you fungal infections in your mouth and just cause irritation to the mouth and throat in general. And a nurse would want to always look out for, we would want to monitor your lung sounds, we want to monitor your pulse ox, we want to monitor what's going on, if it's a dirt, dandruff, allergy, if you're around smoking, or just things that might induce that. And my video went a little bit over, but I just wanted to kind of give you a brief about it. Do you feel like you know about asthma medication? Yeah, good. Say bye to class.